All right, here we go. Hello, everyone, and thank you for watching this webinar on wellness care versus medical necessity. There's no audio taping or videotaping allowed, and any unauthorized reproduction of this target coding presentation is illegal. Just a disclaimer, the information in this presentation is for educational purposes. It's not intended to be legal advice. Target coding does not provide legal services. I've made every attempt to make certain the information in this presentation is 100% accurate, however, not guaranteed. For those of you that do not know who I am, let me tell you a little bit about myself. My name is Dr. Marty Kotler. I'm a chiropractor. I practiced for 16 years. And about 12 years ago, I started a company called Target Coding. That's when I went for my certifications in coding. So I'm a certified billing and coding specialist. I'm a certified professional compliance officer. And, I kind of consider myself unique because most certified coders are not chiropractors. Most chiropractors are not certified compliance officers. So I take that unique approach where I can talk to you about what's the best diagnosis code to pick on a patient and give you clinical information. And at the same time, tell you, hey, maybe even though that's the best diagnosis code, for that particular situation, it won't get paid by an insurance company. So that's where I could, have my clinical experience and my coding and business experience mesh together to help doctors what? Make sure they're billing and coding properly. I'm not the insurance guy. A lot of people call me the insurance guy. I'm not the insurance guy. You want to give me a name? I'm the compliance guy. I want to make sure you're billing and coding properly, whether you're making a lot of money or not. Step one is to make sure you're doing things right. And step two is to make sure you're maximizing reimbursement. That's where I focus on. Once I get the doctor to bill and code properly, then I want to make sure the doctor is maximizing reimbursement because a lot of doctors are leaving money on the table. So that's where we come in. I've written many books on billing and coding and documentation, not only for chiropractors, but for physical therapists and acupuncturists. I write articles to the major publications and newspapers that you see coming across your desk, like Chiropractic Economics, Dynamic Chiropractic, the American Chiropractor. I write for the American Academy of Professional Coders. I write newsletters for many state associations across the country. I do webinars for many state associations across the country. I'm a guest speaker at many state association conventions across the country. So that's a little bit about myself. All right, so now we're going to talk about the difference between wellness care and medical necessity. So let's begin. Medical necessity, in my opinion, this is a very simple equation. If the care is medically necessary, it's payable. See that? How do I know that? Well, you could have a patient, call their insurance company. I'm sure some of your patients have done this. Patient calls the insurance company and says, hi, I want to go to a chiropractor. Does my insurance cover chiropractic? You know what the patient's going to hear? Yes. Yes. Every plan in the country, every insurance plan in the country covers chiropractic care. It's a law. It's a state law. Every insurance plan must include chiropractic as a benefit. So when a patient calls their insurance and says, hey, does my insurance cover chiropractic? They're going to hear yes. Now, you might, if you're out of network in an HMO, and this HMO doesn't cover out-of-network providers, then in that case, there's coverage, but the patient will not have any benefit because you're out of network. So just understand that there's a difference between an insurance company having a chiropractic benefit. Whether or not you want to deal with it is a different story, but patient calls and they say, hi, does my insurance cover chiropractic? They're going to hear yes. And sometimes they'll hear, yes, you're covered for 30 visits as long as it's medically necessary. What did the patient hear? 30 visits, right? So medically necessary, insurance payable. Medicare says if you consider the care active treatment, which means you have diagnosed a subluxation and all the other items, I'm not going to get into all the Medicare rules in this presentation because some of you might not even take Medicare. But Medicare says if it's active treatment, that means it's medically necessary. You bill with the AT modifier and you will get paid. There you go. So active treatment is medically necessary. This is where you should be educating your patients nowadays more than ever because the patients will come in and say, I'm covered for 30 visits. What you should say is, You, the doctor or a staff member, needs to educate the patient. Otherwise, you'll have unnecessary upsets. Staff members listening to this, do you like unnecessary upsets? Do you like when patients hassle you? Do you like when patients argue? No. So set the tone. My recommendation is on the report of findings, whether you do that on the first visit, second visit, third visit, fourth visit, everybody does their report of findings on different day. Most of the doctors I work do it on the second day. So during the report of findings, explain to the patient, Mr. Smith, yes, you are covered for up to 30 visits. So after 12 visits or 15 visits, if you are feeling fantastic, then there's no more coverage according to your health plan. Now, Mr. Smith, if you have pain, you see the slide, everybody look at the slide. If you have pain, you have restricted motion, you have decreased abilities to do your activities of daily living, that's insurance payable. So, Mr. Smith, you have pain, right? Yes. You have restricted motion. Yes. You told me you can't play tennis, you can't ride your bike, you can't go to the gym, you can't sleep, right? You have difficulty doing your normal activities of daily living. That's covered by your insurance. This is during the report of findings. Tell the patient, pain restricted. Then say, but guess what, Mrs. Smith? After X number of visits, you fill in the blank, 6, 8, 10, 12, 15, 30, you fill in the blank. After, let's use, I don't know, 14. So, Mrs. Jones, after about 14 visits, that's what I'm guessing, you're going to have very little pain. You're going to have a great range of motion, and you're going to be able to do most of your activities of daily living. So when you get to that point, we're going to put your insurance billing on hold because according to your health plan, it's not payable. So get that seed planted. Tell the patient chiropractic wellness care, maintenance care, which means you feel great, you're in good shape, we've maintained. You know, there's a difference between wellness and maintenance. Have you ever thought about that? What's the difference between wellness and maintenance? I'll give you my opinion. Wellness is the patient feels fine. The patient comes into your office. They have very little pain. I'll go back to this. Very little pain. They have very good range of motion. They're getting up in the morning. They're driving to work. They're doing their normal activities. They're going to the gym, right? So that to me is wellness care. Now you have other patients like my mother-in-law. If she's always in pain, but no matter what doctor she goes to, she's always the same. So that's maintenance. Like if she came into your office, her pain scale is always between a 4 and a 5. And I've sent her to many doctors, chiropractors and holistic practitioners, no matter what they do. If they give her 5 treatments, 10 treatments, 20 treatments, at the end, she's about the same. So that, in my opinion, is maintenance. So not medically necessary means not insurance payable. Not medically necessary means not insurance payable. Educate your patients. This is about educating patients. I'm assuming that doctors and staff members, you know that maintenance is not covered by most plans, although some are starting to pay for it. So this is pretty easy for you to understand, but maybe what you're listening here is how to educate the patients so they understand, so they're not going to give you a hard time when they come in and go, I'm covered for 30 visits. What do you mean I'm not covered for 30 visits, right? Some patients, you know, I went to another chiropractor. They never told me this, right? You might have to deal with some of that. Performance enhancing care is not payable. You see that person's in good shape climbing the rock. So this patient climbs a mountain and then they come in and go, you know what, Dr. Kotler, I've been climbing mountains, medium-sized height mountains. I want to climb higher mountains. Can you help me climb higher mountains? Of course I could help you climb higher mountains, but just to let you know, Cigna doesn't pay to help climb higher mountains, right? That's what you have to explain to a patient. I want to run faster. Like I had some patients say, I'm hitting the ball further, Dr. Kotler. You know, golfers were coming in. Dr. Kotler, after you've been working on me, I'm hitting the ball further. I'm teeing off. I'm hitting the ball an extra 15 yards. You know, that's a big deal for a golfer. So now they're sending in their friends. And now the friends are coming in saying, Dr. Kotler, can you help me hit the ball further? Of course I can. But Aetna doesn't pay for that. Cigna doesn't pay to help you hit the ball further. So get the patients to understand this. When they reach maximum therapeutic benefit, there's no more insurance coverage. Now, I don't recommend you say to patient, like this is what some doctors say. They go, well, if your care is medically necessary, you know, it's payable. But right now, your care is not medically necessary, so we want you to pay cash. Think about that. When you're saying that to a patient, Mrs. Smith, your care is not medically necessary anymore, so now you need to come in once a week and pay cash. See that some patients might go, so Dr. Kotler, you just said my care is not medically necessary, so why should I come in, right? So I get the patient to understand there's a difference between chiropractic necessity, chiropractic necessity slash clinical necessity is different than medical necessity. Now, that might not resonate with all of you, but some of you, I know it does. I have a whole bunch of clients, they specialize in correcting postural distortions. These are patients that are coming in without any pain. They feel fantastic. The doctor is correcting scoliosis, forward head translation, and all these other postural distortions. Upper cross syndrome, the patient feels fine and is working out, going to the gym, doing all their normal things. But you're treating the patient. So is that medically necessary? So what is medical necessity? You know, when I first started practicing, you know what my definition of medical necessity was? Patient has a subluxation. That was it. Patient has a subluxation. I mean, that's the way I was taught. That's what my mentors taught me. That's what I heard. Patient has a subluxation. You find that subluxation, whether the patient has pain or not. You adjust the subluxation. Here are the subluxation codes if you're interested. If the patient has a subluxation, you adjust the subluxation and you should get paid for that. That's the way I was taught. That's the way I was trained. That's not the case anymore. You know that. Insurance doesn't pay just for the treatment of a subluxation. The patient has to have functional deficits in order for it to be medically necessary. So if the patient just has a subluxation, everything else is normal in their life, it's not insurance payable. There's also traumatic subluxation codes, which I don't recommend, but I just wanted to show you. There are traumatic subluxation codes. There are pain and symptom codes. Is this medically necessary? Are pain and symptom codes medically necessary and insurance payable? Sometimes yes. Radiculopathy? Yeah. Patient has radiculopathy. That's going to be insurance payable, typically. Disc degeneration? Disc degeneration is considered a long-term treatment diagnosis code by many insurance plans, especially Medicare. Disc disorder and disc displacement, we're talking about herniated discs, bulge discs, protruded discs. That's typically covered by insurance, but it's not just about the symptoms. The patient has to have functional deficits. Sprains and strains are typically covered. Headaches are typically covered. You want to prove medical necessity? How about using outcome assessment forms? Now, there's two different schools of thought. Many doctors, here's the first school, school A, school number one. I want more visits out of the insurance company. I want to get more insurance company money. That's school of thought number one. School of thought number two is I want more money out of the patient's pocket. I want the patient to understand that this is not covered, and I want the patient to pay me. I want more money out of the patient. So if you're in a lower socioeconomic area or you're PI, work comp, no fault, you're not getting money out of the patients. Medicare, Medicaid, you're not getting money out of the patients. So what do you want? You want more visits paid. Your PI, you think your PI patients are going to pay you out of pocket? They're not going to. So you want more money out of the insurance. You want more money out of the insurance, you have to do certain things. Here's one thing, use outcome assessment forms. Let the patient set their own fate. If the patient's forms prove that it's medically necessary, keep billing. If the forms come back when you score them, you're going to score these forms. Let's say you're a teacher and a student came up to you, handed their paper, and they scored a 42. That's an F, that's a failure. This student needs more help. So you keep helping that student. Next student, you're a teacher. The student hands in their test and they scored 100. Well, this student doesn't really need too much help. Maybe this student will help tutor other students. So score these forms and you'll be able to see, does the patient need more help? That's medically necessary. The patient is scoring great. They have no problems. If a patient here, this is a very good form. For those of you that don't have this form, you should get it. If you want this form, email amy@targetcoding.com. This is any patient that comes in with lower back and leg problems. So if the patient, put number 5, putting on your socks and shoes, no difficulty at all. Walking between rooms, no difficulty. Getting in and out of the car, no difficulty. Performing heavy activities around the home, no difficulty. Lifting a bag of groceries out of the trunk of a car, the patient puts no difficulty. To a patient like this, you should explain, hey, Mr. Taylor, we're getting close to wellness maintenance. Remember, we spoke about that. Insurance doesn't cover it. You don't have to stop them abruptly if they score perfectly. What happens if the patient scores? Getting in and out of the bath. I have extreme difficulty doing that. Putting on socks and shoes, extreme difficulty getting in and out of the car. Then you could probably continue to bill insurance so the patient will be able to help you. What about complicating factors and comorbidities? Do you ever report these? I mean, just think about that. Here comes patient number 1, low back pain, that's it. Patient number 2 has low back pain, is overweight, is taking medication for anxiety, and it also has diabetes. Now, are you going to use those complicating factors to try and get more visits out of the insurance company? You can. Or do you want to direct the ship and go, wait a second, just because the patient is overweight, I don't think that condition, that complicating factor is contributing to the patient's headaches. Then don't use it. So what is medical necessity, right? Remember, I gave you my impression. The patient has a subluxation, and I adjust the subluxation, and that should be medically necessary and insurance payable. It's not. It's not. That's not the way it works nowadays. If you're doing that, you're trending like it's 1992. What is medical necessity? Don't ask me. Don't ask your patients. Don't ask your staff. Ask the insurance companies. If you're billing Aetna, go to their policy. It gives you their definition of medical necessity. It's all here. You want to know what Cigna considers medical necessity for chiropractic? Here it is. Go ahead, take a look. You want to know what Anthem, Blue Cross Blue Shield, which a lot of you are using Anthem, billing Anthem. I would say 60% of the country is covered by Anthem, Blue Cross Blue Shield. What's their policy on chiropractic? Here's Blue Cross Blue Shield of Illinois' policy on chiropractic. What do they say? Many of them say you need a written treatment plan. How many of you deal with ASH, American Specialty Health? What's their definition of medical necessity? If you're dealing with ASH, especially if you are in network, you better know what medical necessity is, or else you're going to have stress. Your staff is going to come up to you, doctors, and go, we are frustrated. We don't know how to do this. We don't understand. We're sending in notes, we're getting paid. We're not sending in notes, and we are getting paid. Should we send in medical necessity? What tier are we in? All of that stuff with ASH, it'll drive your staff crazy unless you know how to figure out the difference between medical necessity and wellness non-payable care. Also with Optum, how many of you deal with Optum? Same thing. Oh, you want the formal definition of medical necessity according to CMS? Here it is. It's a service treatment that's required to identify an illness or injury. It's consistent with the symptoms. It's appropriate under the standards of care. It's not solely for the convenience of the doctor or the patient. It's the most appropriate service which can be safely provided to the patient in the most economical manner. Are you selling back braces for $1,500 and getting paid by insurance? Or can the patient get away with a $30 back brace that they could buy in Walgreens? Now, a lot of the information that I talk about as far as medical necessity, insurance payable, come from the E&M guidelines. The E&M guidelines, the codes are your new patient codes and your established patient codes. So now you're going to do an exam. Is this a medically necessary exam? Are you going to be billing insurance? If you're going to bill insurance for 99203, which is the most commonly billed new patient code, that means you did a detailed exam. These are the E&M. By the way, if you want a copy of the E&M guidelines, you could send an email to amy@targetcoding.com. So just to let you know, you're required to get 12 findings according to the E&M guidelines if you're billing 99203. So here's how you could start gathering findings: palpatory tenderness, subluxations, range of motion, muscle spasm, posture, gait, sensation, skin. You could take a look at the skin of the patient's neck and back. The skin of the neck and back look normal. That counts as 2 findings. I have this 12-point exam that I go over. Even a brief mental assessment counts as a finding. How do you do that? Just write, if the patient appears oriented to time, place, and person, jot that down. That counts as a finding. So you need, if you're going to bill insurance for a medically necessary exam, then at 99203, then you need 12 exam findings. Now, what happens if you're billing insurance and it comes back, denied, the services were not medically necessary? You should dig deep and find out the reasons. Here's a bunch of reasons. These are the most common reasons why you'll be denied. There's the first one. Notes appear as the care is maintenance. Maintenance? There's a lot of other reasons. Your notes don't show improvement. The functional limitations have been met. Your notes are not legible. Treatment plan is missing. There's no signature. The notes appear templated, verbatim, cloned, cookie cutter. You're not mentioning compliance with home care instructions or DME. But let's go to the first one. We're not paying you, Dr. Kotler, because the notes appear it's maintenance. So you knew I was going to ask this, right? What's maintenance care? What is maintenance care? Again, it depends who you ask. Who are you going to ask? You want to ask your friends? You want to ask a practice management consultant? What's maintenance care? You want to ask a certified coder like me? My recommendation is don't ask anyone. Do research. Find out right from the companies you're billing. Here, this is maintenance. According to Medicare, maintenance is not covered because this is kind of funny. It seems like they should cover it. Medicare says maintenance therapy includes services that seek to prevent disease, promote health, prolong and enhance the quality of life, maintain or prevent deterioration of a chronic condition. They should pay for that, right? But they don't. Now, be careful. If you're going to bill Medicare for maintenance care, do not use S8990. S8990, see the bottom of the screen? That's the wellness code. That's what a lot of doctors consider the wellness code. If you use S8990, it'll come back, patient may not be billed. That's been my experience. So if you're going to use a code to bill Medicare for maintenance, you have to use the spinal manip code, have the patient sign the ABN. If they check option 1, then you're going to use the GA modifier instead of the AT. So again, maintenance care, wellness care is not payable. Here's what happens. A lot of you are getting stuck in the middle. Let me clarify. Every single patient in your practice you can categorize into 2 categories. Every single man, woman, and child in your practice right now that's coming in today, you could put into one of 2 categories. Number 1, active care, which means what? I went through it. Pain, discomfort, decreased ability to do their normal activities. Active care is paid by insurance, or the patient pays cash if you're a cash practice. Category 2, maintenance wellness. It's cash. Nobody pays. Very few. Nobody pays for wellness maintenance. Take that approach. But some of you are caught in the middle because you're trying to be a nice guy. You're trying to just pander to the patient, or sometimes patients bully you into doing things and you cave in. Staff, doctors, don't do it. Patient pops in, hi doc, I was just driving by. Yeah, I need a little tune up. 2 weeks later, doc, yeah, my neck is bothering me a little bit. 2 weeks later, doc, I was just driving by. Yeah, I think it's time. Yeah. And that's going on for months, even years. I was just talking to a doctor the other day. He's like, Marty, I've been treating this patient twice a month for 2 years, and now the insurance company wants the notes. Okay, how's that going to look? He sent me the notes. Every visit looks the same. The diagnosis codes, the procedure codes, it's exactly the same for 2 years, twice a month for 2 years. He has to send that in. It's not going to go well. I don't think it's going to go well. Maybe, I've seen crappy notes pass audits. I've seen fantastic notes fail audits. I don't know, but I'm going to come up with a game plan, recommend he put together a treatment summary. Don't get caught in the middle. It's not worth it. If your gut instinct is telling you, doctors and staff members, if your gut instinct is telling you, you know what, this is maintenance care. Don't hold back. Don't be afraid. Explain to the patient that there's no more coverage. Or give them a little warning shot. Say, when you come in on your next visit, I want to do a re-exam. Give them an outcome assessment form. If not, you could start getting letters like this. Look at this. This is a Cigna audit. The Cigna wants $250,978.50 back for all these things that the doctor didn't do right. Here's another doctor put on a prepayment audit. There was no signatures, no plan of care. This doctor was put on a prepayment audit for 97110. So have good financial policies. Like, what's your policy on collecting copays, deductibles, and coinsurance? Is it okay to waive copays and deductibles? The answer is yes, but sparingly and rarely, once in a while. You know what? Here, I'm going to admit it. I gave one patient free care. What did you say, Dr. Kotler? Yeah, I had a patient come in who's actually the father. Ed came in. He's like, Dr. Kotler, can you take care of my daughter, Julia? She's got a lot of back pain, but can you give her a little break? She has no insurance. She just lost her job, and she's a single parent. It's been tough for her. I said, Ed, send in your daughter. I'm not going to charge her. No charge. Free. Yeah. I gave her free care. I didn't do it across the board. I didn't do it on all like some of my clients call, could we waive the copay on all the teachers? They don't make a lot of money. Can we waive the deductible on all the firemen? No routine waiver. If you routinely waive copays and deductibles, you can get a letter like this. And then what are you going to do? This is a doctor I've been working with for years, about 4 years now. He doesn't collect copays and deductibles. I've been warning him, please collect something. Okay, I will, Dr. Kotler. Now he gets a letter from Cigna. It says we want copies of patient ledgers. We want documents that show when bills were sent to the patient and how much money has been paid by the patient. He doesn't know what to do now. What's your policy on discounts? What's your policy on, you should have policies, especially financial policies. And now we have this transition to wellness care. Some patients don't get it. So I call it the good news, bad news visit. Mrs. Jones, yes. You used to be covered for 30 visits, but now you have something called managed care. You have a managed care plan. You've heard of managed care? Yeah. We have to pre-authorize care. We'll be able to get you the first 5 visits approved, and then we'll need to do a re-exam. Or Mrs. Jones, good news, bad news. The good news is you've reached wellness. The bad news is your insurance doesn't cover wellness maintenance. Here's the information if you want to call your insurance company. That's another thing we train our CAs. If the patient, some patients just, they don't get it. They want to, check into it. Fine. Give them the name of the insurance company, the name of the person you spoke to that gave you the information and the phone number, and say, here, speak to Shelley. We spoke to Shelley at your Aetna plan. This is what Shelley told us. Here's her number. Call her. See if it's, true, because this is what I don't understand. I went to the other chiropractor. I didn't have to pay anything, or I thought I was covered for. Yes. So proper billing and coding is important. With your Medicare plans, make sure you know the difference between Part B and Part C with Medicare. If you're not enrolled in Part B, you're not allowed to treat patients. Part C, you're okay. That's why I like to put this chart up. Again, if you are treating Part B patients, but you're not enrolled in Medicare, you're not billing Medicare. Like some doctors go, I'm not in Medicare. I don't get involved with Medicare. Patients come in, they just pay me cash. If that's a Part B patient, you're doing something illegal. Staff members, talk to your doctors. Tell them to stop doing illegal things. It's not worth it. Don't treat Medicare Part B patients if you're not enrolled in billing Medicare. Part C is different. Part C is fantastic. Actually, it could be. Potentially, I have clients, patients are coming in saying, I have Medicare. And we train our doctors and staff, ask the patient to see their card. If their card is a regular insurance card, it says Medicare Advantage Plan, check into it. You don't have to be enrolled in those. So here, I just wanted to show you. There's active treatment, a Medicare sample active treatment claim. You see the 98940 AT. Now, after about, you fill in the blank, 8 visits, 10 visits, 12 visits, 35 visits, 78 visits, 150 visits, the patient reaches wellness maintenance. They sign the ABN form, and they check option 1. You see, there's how it goes, 98940 GA. What about patients, they come in, these are the best patients. Doc, just give me a walkout receipt. Wellness, maintenance, active, not active. Here's a sample statement. Sample wellness statement right here. So have good financial policies, keep fees simple. I am dealing with about, let's see, about 6 cases right now where the doctor had a board complaint. The patient filed a board complaint. They're all related to money. Doctor charged too much. Doctor didn't give the patient the money back. The doctor recommended, careful with your fees, keep it simple, and tell the patients if you give discounts, tell them what your normal fees are, or else they can get upset once you start billing your regular fees to their insurance, right? You could have a cash patient coming in and you're giving them a discount, and then they get a job and now you're billing their insurance and the fees have tripled. Patients can get confused. All right, just want to close with a few closing comments here with my 9-step action plan. Step 1, get proactive. Don't wait for the oil light to flash on the dashboard. Get out of the car and check the oil. Step 2, staff members, make sure the new patient signs all the forms, completely fills out all the forms and signs them. Very important. Those of you that do TENS machines, back braces, make sure the patient fills out how long have you had the problem in their writing. Step 3, doctors, before you go in and start talking to the patient, this is a risk management. Not only do I teach billing and coding seminars, continuing education seminars on chiropractic billing, coding, and documentation, I also now teach risk management, ethics, and medical errors. So as far as risk management goes, docs, read the paperwork before you see the patient. Step 4, review the policies from the insurance companies you bill. Find out, what do they say about wellness, maintenance, when to bill, what not to bill, how much you can charge the patient. Step 5, understand the what and the why. Your CPT codes are what you're doing. Your diagnosis codes are why you're doing them. Make sure they pair. I call it code pairing. For example, what are you doing? Mechanical traction? That's 97012. Why are you doing it? Oh, the patient has cervical radiculopathy, M5412, or disc degeneration. See, I like pairing. These are, it's like I have a picture of Food and Wine Festival. You ever go to a Food and Wine Festival? I've done many of them. They're fun. And you have an expert. You have someone called a sommelier who is a master that shows you how to pair your food and your wine for that maximized culinary experience. Great. I do it for coding. I will pair your procedure codes. You see, myofascial release 97140. What does that pair with? I'll tell you. It pairs with myofascial pain in the cervical region, M7912. It pairs with lumbar disc displacement. Oh yeah, I consider myself a coding sommelier. I'll show you how to pair your codes. Here, what else? You doing therapeutic exercises? Why? Oh, that pairs beautifully with neck pain and shoulder stiffness. What are you doing? A chiropractic adjustment? What does that pair with? Subluxations, right? Step 6, do a self-test on your SOAP notes. Step 7, always keep learning. Always keep learning how to help more patients, improve your business, attend seminars, webinars. I strongly recommend putting together a billing and coding policy and procedure manual for who? Not for your patients, for your staff, to prevent disgruntled employees from leaving and reporting you to insurance companies. This is mostly for staff. It's also used in an emergency situation where a doctor's been audited. If a doctor has been audited by an insurance company wants $300,000 back, immediately we are putting together a billing and coding policy with procedures and trainings and documenting that the doctor is doing self-audits. It's going to reduce the fines. It always reduces the fines and penalties. So you could use it proactively. You could use it in an emergency situation, a policy manual. Step 9, conduct regular meetings with your staff. Document them. Do a spot check if you're using a billing company. By the way, Target Coding now does billing. Do a spot check on your billing company. Make sure they're using the codes that you gave them. I have 2 doctors right now being audited. It's because the billing company was adding modifiers that weren't necessary. Another one, they were upcoding. They were changing the 4.0 to a 4.1. You want to do this so you could SWAN. That's my favorite acronym, SWAN, which means sleep well at night. So just a few closing comments. I just want to thank everybody for attending. I hope you learned a lot. Here's my contact information if you want to email me directly, and there's my website and phone number. Contact us for a free consultation. We offer free consultations. You have questions on this topic, you have questions about any topic, you're thinking about going multi-specialty, set up a phone consultation, no charge. You just want to chat about your practice, you want to chat about our services and products on how we can help you. You're getting denied for one particular situation, you can't figure it out, set up a free 15-minute phone consultation with us. We love doing them. We do them every day. We have tons of them that we do, and we enjoy doing them. And so do the people that call us. We have tons of testimonials on how we've helped people just with our free 15-minute phone consultations. And besides these webinars, let me share you what we do here at Target Coding. We also offer products. We have videos and training manuals and books. We do on-site trainings and one-on-one consulting. We install compliance plans, HIPAA compliance and Medicare compliance programs. We have memberships. We do seminars all over the country. We have something called our Target Coding Compliance Program, which consists of the big 3, HIPAA, OIG, and OSHA. I have 3 questions for you. Do you get HIPAA headaches? Do you have OIG procrastination? Do you have OSHA indigestion? These are the 3 things. It's mandatory. I don't care where you practice. I don't care what state you're in, or the federal government doesn't care what state you're in. Your chiropractic board, this is all mandatory. Doesn't matter what state, where your practice is. These 3 things are mandatory. So hopefully you're doing them. For those of you that are not doing it, try doing it on your own. Do some research, take some courses, go online. You might be able to do it on your own. If you don't have one, if you don't want to do it on your own because it's just taking up too much time, then outsource it to us. We do all the heavy lifting. We put all the policies and procedures together for you based on what you tell us. This is a custom manual. You don't just pay us and we send you a book and you put it on your shelf. That's the last thing we want. We are annoying. Actually, that's what we hear from our compliance clients. They're like, oh boy, right, you're right. Thank you for reminding me. I got to go find out, who my business associates are and enter it into our cloud-based portal. So we're not just going to send you a book. We're going to customize your policies and procedures for your practice. And then we're going to show you how to implement them. And why do you want to do this? So you could sleep well at night. Those of you that have problems with ASH, you want to get more visits out of ASH, or you want to get more cash out of your ASH patients? If you answered yes to any of those 2 questions, then schedule a live training. You pick the day, you pick the time, we do a live training. It takes about 90 minutes, and we'll show you everything you need to know pretty much about ASH, billing, and coding. I also have a book that I've written. It's called The Book on the Best ICD-10 and CPT Codes to Improve Reimbursement. It shows you the codes that pay the most visit. It shows you how to code pair. It shows you how to substantiate the most common diagnosis codes. It shows you the clinical rationale for the CPT codes that you're using. Here's an example. We show you the long-term diagnosis codes and how to justify them through ortho-neuro-chiro tests. We show you the CPT codes and the clinical rationale. See, this one's for therapeutic exercises. Why do you do therapeutic exercises, Dr. Kotler? There's the reason right there, right out of the descriptions of the AMA CPT code book. It also comes with cheat sheets. Oh, we just started doing, well, it's about 6 months ago, CA boot camps. We have 4 modules on our CA boot camps. Module 1 is front desk and patient relations. We go over new patient onboarding, intake forms, financial policies, getting paid at the time of service. Module 2, billing and collections, how to fill out the 1,500 forms, revenue cycle management, time management, efficiency, organization. Module 3, those of you that have CAs that come into the back office with you and they're doing the therapies and doing the notes. We have quite a few clients where the CAs are doing the notes. They're in the back rooms with the doctor. We show you how to do all that in Module 3. Module 4 is compliance and management. I'm going to put it all together. For those of you that have an office manager, we want to show you how to make your office manager effective, respected, and how to be able to supervise a large staff. Target coding now does billing. Outsource your billing to us. Contact us. Let us know. Maybe you're tired of your present billing company, or you have such staff turnover, you're just tired of hiring and firing and hiring and quitting and rehiring, right? It's a lot of work. So those doctors, in general, I recommend you do in-house billing. Just to let you know, we recommend in-house billing if you have a good quality in-house billing person. But many doctors have this constant turnover of staff. Those offices should probably outsource the billing. We also sell forms. We have a whole bunch of 75 customizable forms, letters, logs, and templates, new patient forms, financial administrative forms, exams and treatment plan forms, sample soap notes, letters of medical necessity, fight back letters. You ever get your exam bundled with the adjustment? We have a great fight back letter on that. You ever get your 97140 or 112s bundled with the adjustment? We know how to handle that. We also threw in some physical therapy forms and acupuncture forms. And we have a whole section on Medicare. Medicare sample an exam, soap note, re-exam, sample ABN forms completely filled out for PAR and non-PAR and Medicare Advantage Plan forms, plus all your HIPAA forms. That's another thing we do. All right, we're going to get to questions and answers now. Here's another thing. People say, well, Dr. Kotler, I just want you to check my notes. You know, I feel like I'm good with everything except I would like my notes evaluated. No problem. We'll check your notes. We have something called our chart. It's a comprehensive chart audit and fee schedule review. You send us 5 charts and we'll dig through them. We'll scrub them. We'll tell you what we like, what we don't like. We'll probably find money you're leaving on the table. How do I know that? You ever see those farmers insurance commercials? We know a thing or two because we've seen a thing or two. Same thing here. 12 years of evaluating thousands of practices. We typically find money that doctors leaving on the table. There are some doctors we've added 1 CPT code. It's equal to an additional $10,000 of income. All right, let's go over to questions and answers. Oh, wait, we have our cruise. My staff always remind me to tell everyone we have our 2nd annual Target Coding Cruise Seminar coming up. You want a vacation and a tax deduction and learn coding and billing and documentation and get 10 credits? Well, there you go. I just described our 2nd annual cruise. You may want to come. The best cabins are already sold out. So they're close to being sold out. Now, the best, most people like a balcony. So those are going quick. There's only a few left. So if you want to take action, give Vicki, the travel agent, a call. Oh yeah, this is we had about 50 doctors. This is a picture of our first annual target coding cruise. We gave out T-shirts. We had funny ICD-10 codes on the back of the shirts. We had a great time. Oh, we also have videos and compliance plans, and yeah, we have seminars, a whole bunch of seminars coming up. So again, here's my contact information. I want to thank everybody for attending. I hope you learned a lot.